Thank you, Mr. President. So before I give my closing speech, I would like to take a moment to recognize the excellent chairmanship of our meetings. And I would like to first call upon Mr. President. Could you please come and join me to be presented with the ceremonial gavel. You know, we should always do an improvement. I just read what's on the gavel, and it doesn't include the name of the president. So maybe next time we should print that too. The President David Parerenyatwa. And next I ask chairperson of the committee, Mr. Arun Singhal. He told me a very serious thing, but I was going to share with you. He said it's confidential, me and you only. So zip. And next, I would like to ask the Vice Chair of Committee B, Dr. Stewart Tesmani.
Thank you very much.
Yeah, he's right, by the way, Stewart. It looks like wrapped chocolate. So he suggested that next time it should be a gavel made of chocolate, since we're in Switzerland. Thank you. I would also like to recognize the other officers, Dr. Bronstein, Dr. Martinez, Dr. Firozuddin, and Dr. Mbala for their support to the chairs. So now So if you allow me now, Mr. President, may I go to my closing speech? Sure. Thank you. President of the Assembly, Dr. David Parerenyatwa, Excellencies, Ministers, Heads of Delegation, ladies and gentlemen, colleagues, friends, staff of WHO, sometimes the challenges of our world can feel overwhelming. Poverty, hunger, inequality, pollution, violence, war, disease. But we come together as nations of the world because we choose not to be overwhelmed. We choose hope. We choose a better future. In the past year, I have visited several conflict zones because, as you know, in our mission, we're saying serving the vulnerable, and we need to be with them. And during those visits, I have seen sufferings in the people who pay the heaviest price for decisions made by other people. Everywhere I go, I have the same message: health as a bridge to peace. Health has the power to transform an individual's life, but it's also the power to transform families, communities, and nations. This week, you have charted a new course for WHO. You have made a firm statement about what you want us to do and the results you expect to see. The general program of work you approved gives us a strong mandate and an ambitious agenda to get on with. Now it's time to implement it. We have no time to lose. 5 years is no time. Everything we do must be evaluated in light of whether it will help us to make progress towards the 3 billion targets with a sense of urgency. We will invest and reinforce anything that helps us to do that. As you know, universal health coverage is the foundation. Investing in stronger health systems will help make the world fairer, safer, and healthier. As President Kagame said on Monday, universal health coverage is an opportunity, not a burden. I wish to thank the many countries who made the concrete commitments this week to strengthen their health systems. WHO stands ready to support you with world-class technical know-how to turn those commitments into realities. In the coming weeks, months, and years, we look forward to engaging in policy dialogue with each member state to identify areas in which the best health systems can be made even better, and the weakest and most fragile can be supported and strengthened. Of course, we need to work with all countries. No country has a perfect system. We see fault lines almost in any health system. And that's what WHO is for, to help countries. This week, we have seen proof that the reforms we have made in our emergencies program are working. The work started by my predecessor, Dr. Margaret Chan, is paying off. Shishi to Margaret Chan. The Independent Oversight and Advisory Committee has given its stamp of approval to our work on emergencies and has recognized that we are better positioned to act with greater speed and predictability. The current Ebola outbreak in the Democratic Republic of the Congo has demonstrated exactly that. I'm proud of the way that we have worked seamlessly at all 3 levels of the organization. Let me assure you that I am personally committed to ensuring that we do everything we can to stop this outbreak as soon as possible. And the commitment of the government, of course, and the leadership is at the center, which we really admire. We have come a long way, but there is always more we can do to make the world safer. I appreciate the hard work you did this week to negotiate the resolution on the international health regulations, which will help to improve public health preparedness and response by strengthening core capacities. The new Global Preparedness Monitoring Board that we launched with the World Bank this week is another vital brick in the wall of global health security. I'm very grateful that Dr. Gro Brundtland, former Prime Minister of Norway and former Director-General of WHO, and Mr. Elhaj Asi, Secretary General of Red Cross and Red Crescent, agreed to co-chair this new mechanism. You have also made important commitments to turning back the tide on diseases that have plagued humanity for centuries. You have committed to implementing a roadmap to reduce deaths from cholera, by 90% by 2030. You endorsed our 5-year strategic plan on polio transition to strengthen country health systems that could be affected by the scaling down of the global polio eradication initiative. You passed resolutions on tuberculosis and non-communicable diseases that will help us prepare for the high-level meetings at the UN General Assembly in September to ensure we make the most of these historic opportunities. You approved our new global action plan for physical activity, which is essential for our fight against non-communicable diseases. The very successful walk the talk event last Sunday and the regular yoga sessions during our committee meetings have helped to liven up the Assembly and are important statements that we practice what we preach. You asked us to develop a 5-year roadmap to address access to and the global shortage of medicines and vaccines. This is a major cause of financial hardship. I look forward to presenting the roadmap to you next year. For the first time, you committed to reducing the unacceptable burden of deaths and disabilities from snake bite. You have resolved to take action on assistive technologies and rheumatic heart disease. And you have agreed to increase the development and use of digital technologies to improve health and keep the world safe. I am also pleased that you approved a resolution committing to us to receiving 50% of our interns from developing countries and to paying them a stipend by 2020. This is an important step forward, making WHO fairer but stronger too. I would particularly like to thank the Wellcome Trust, which has generously offered to support 150 interns from low and middle income countries in the next 3 years, and I'm really glad to see that the ball is rolling with regard to interns. So your decision has already mobilized support. Ladies and gentlemen, the GPW calls on us to measure our success not by our outputs, but by outcomes, by the measurable impact we deliver where it matters most, that's in countries. Ultimately, the people we serve are not the people with power. They are the people with no power. The people of Bikoro who look to us to protect them from Ebola. The mother in Yemen who looks to us to keep her child alive. The people who face a daily choice between sickness and poverty because they cannot afford health care. So the true test of whether our discussions this week were successful or just more talk will be whether they result in real change on the ground. As I said on Monday, there are 3 keys to our success. First, a transformed WHO. This is a job especially for the Secretariat, with, of course, support from you, the Member States. Second, political commitment. This is a job especially for you, the Member States, with support from the Secretariat. I especially want to thank my brother, Martin Chunkong, from the Interparliamentary Union for his partnership. We're preparing new memorandum of understanding with IPU to strengthen the role of parliamentarians in achieving universal health coverage. And we agreed to have a meeting of parliamentarians here at the World Health Assembly every year. We're also hopeful that a resolution on universal health coverage will be passed at the IPU Assembly in March next year. And the third key to success is partnership. This is a job for all of us, the Secretariat, the Member States, and all of our partners who can help us achieve our mission. I urge each of you to go home with a renewed determination to work every day for the health of our people. Do not accept the status quo. We should not accept the status quo. We should not believe that some problems can never be resolved. We should choose to believe instead that it's within our power to make real and lasting change. The commitment I have witnessed this week gives me great hope and confidence that together we can promote health, keep the world safe, and serve the vulnerable. I thank you and have a nice journey home. Thank you so much. Look forward to serving you much. Thank you. Thank you so much.